Hello, and welcome to the Holistic Success Show, where we introduce expert insights on engaging topics in higher education. Today, we are thrilled to welcome Reham Fawad. She's our AVP of Growth Products at Acuity Insights. Reham works very closely with our partners on program management, as well as a whole host of other things, and has a deep understanding of the data silos that exist in medical education. She's here today to chat about our analytics product and an exciting new update that will allow for even greater democratization of data. Welcome, Reham.
Thank you, Anju. I look forward to our chat today.
Good deal. Okay, so let's get started. So, Reham, for anyone who might be unfamiliar with our analytics product, could you start us off with a quick rundown of what analytics is all about?
Yeah, absolutely. So, as you know, Anju, we all live in a sea of data, and usually I like to call it a tsunami of data where data comes at us from every directions. And medical schools are no different. They collect a ton of data across grades, evaluations, match results, you name it. The challenge becomes that all of the data that they're using and putting in exists around different disparate systems like ExamSoft, Canvas, or other tools that programs may be using. What our analytics product does is really bring all of that fragmented, disconnected data together into one central place and then allows people to analyze and visualize all of that disparate data to give institutions a clear picture of how their programs are performing, how their students are progressing, and more. So, really, it helps leadership make data informed decisions for better student and program outcomes.
Right. Okay. So that makes a lot of sense, especially in an environment where learners, are constantly being evaluated through a whole host of systems. And you talked about medical programs. Actually, in higher education, they tend to be the most complicated programs with so many moving pieces, so many different stakeholders. So thank you for explaining that. So historically, analytics has mostly been used by senior leadership, folks like deans and directors. So why has access been so limited up until now?
Yeah, that's a great question. It really comes down to data sensitivity and permissions. And if you really think about medical education, health sciences, healthcare, a lot of that data is confidential because there are patients and people involved. Because of that, senior stakeholders like the deans and the directors that you mentioned are typically the ones who have been trusted with full visibility of the data. And that's really where analytics started, primarily serving senior leadership needs. So up until now, our system permissions were essentially all or nothing. So meaning if you had access, you could see everything, but if you didn't, then you could see nothing, which isn't really ideal when you only want someone with a specific subset of data to be shared with them. So that model limited our ability to involve others who could benefit from the data, such as student advisors, even faculty who are supporting learners through their journey within the program.
Yeah, so that sounds like a real barrier, but I understand this new update actually changes everything.
Yeah, exactly. As analytics has grown, Anju, we realized there are other program stakeholders who also wanted to benefit from the data, and it makes a lot of sense, right? So we're introducing what we call data filter permissions, which offer much more granular control over who can see what across different stakeholder levels within analytics and the visualizations we offer. What this does is it really opens up the door to safely involve more people in the student support process. So, for example, again, a student advisor can now be given access to just their students and only to the data that's relevant to advising, right? So that's something we wouldn't typically do in the past. So think of it like a student's chart, right? Like each section has different types of information: exam scores, clinical evaluations, narrative feedback, match results, whatever. Instead of giving someone the whole chart, now you can decide which sections they see and even which students' charts that they can actually open. So you're only sharing data that's relevant to them particularly.
Yeah, right. So that sounds like a major step forward in really enabling more collaboration around the school. And I suppose it's also safer and more efficient than having to email spreadsheets around.
So absolutely, Anju, it's a win-win because you reduce privacy risks while also empowering more stakeholders to make more informed decisions. Spreadsheets are prone to error, prone to privacy
Mhm.
risk, prone to just being shared outside of the group that they're supposed to be shared with. Also, on top of that, the programs can now manage their own users, which wasn't possible before. So, what that means is now programs can easily assign and tailor the views themselves that they're sharing without relying on us at Acuity or submitting, support tickets to configure things in the back end.
Okay, great. So let's just dig into that a little bit more. How does this actually improve program management or learner support on a more practical level?
Yeah. So let's say a school wants to track how learners are performing on different types of assessments over time. With data filter permissions, they can allow course directors, for example, to view just the grades and feedback for their course. Or they can let advisors track longitudinal performance for the students that they support. So that really means less time spent building ad hoc reports or chasing down data and all of that kind of time intensive admin type of work with stronger compliance with privacy requirements. And ultimately, really what it is it's more time and more targeted support for learners who really need it the most at the end of the day.
Is there anything else new or interesting with analytics that we should know about?
So previously, analytics users couldn't manage their own user access. Now they can, and I want to just build on that a little bit. So with the introduction of data filter permissions, end users obviously now have the ability to manage access within their teams, which allows them to grant the right people the right level of visibility. So what this does holistically now is give programs more control and flexibility, making it easier and safer really to bring the right people into the learner support process and the decision and improvement processes on their ends.
Yeah, that's amazing. Thank you so much for sharing all of this with us, Reham. It was such a pleasure to have you on our show. And, analytics is just such an exciting product. And we sincerely appreciate you being here and giving us an overview of this exciting new update on the product. I can't wait to have you back here again.
Thanks, Anju. I'm excited about where analytics is headed and look forward to more conversations in the future.
Yeah. Thank you also to our listeners. And, thank you for those that join us on the Holistic Success Show. If you enjoyed today's conversation and want to hear more insights from experts in higher education, be sure to like, subscribe, and follow us on YouTube or your favorite podcast platform. We'd also love to hear from you. So please do leave us a review or reach out with topics you'd like us to explore in future episodes. Until next time, thank you so much for joining us. If you enjoyed this episode of the Holistic Success Show, please be sure to check out our other episodes. We have episodes coming out regularly all the time, so please be sure to subscribe so that you can stay up to date on all things related to student and program success in higher education.